Hey everyone, welcome to the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is the co-founder and CEO of Regard, Eli Ben-Joseph. Eli, how's it going?
I'm doing great. How are you?
Doing well. Super excited to have you here. You've had a busy few weeks, some big announcements, the fundraise. First, talk us through like how. I hate this question, by the way, but you know what they always ask on game show, like on when you win American Idol, how does it feel? I'm going to ask you that, even though I think it's one of the worst questions out there. But how do you and the team feel about all that's happened recently, and where are you going to be investing post raise?
Yeah, it's been great. We've been working really hard over the last many years to get here. The company started with just a few of us grinding it for a long time to build a product that will be accepted by clinicians in their workflow, and it's just something that takes time no matter how you cut it. And we've started to have a bit of the dividends pay out in the last couple of years with health systems and physicians taking note of what we've built and it's how it's different from what else is out there. And I think the raise that we had is a testament to that and to the growth that we've experienced and to excitement about the future of what we're doing. So the team is very happy about it. I'm very happy about it. You know, my co-founder and I always daydream what would we do if we had X extra dollars in the bank account, and it's kind of cool to have that option now.
It's super clear, right? This has been the case for years that clinicians are burnt out. So, you know, from your point of view, like when did you decide that you needed to build this to help reduce that burnout? Do your part to reduce that burnout.
It started quite a while ago. I was finishing up grad school at Stanford, and actually, it started even before that. So before going to grad school, I thought about maybe going to medical school, and I took the MCAT. So did my co-founder Nate, and our third co-founder Thomas. All three of us had taken the MCAT. We all thought we were going to go to medical school, and throughout experiences shadowing doctors, we all felt something was amiss and trusted that instinct and decided not to go to medical school. And I ended up going to grad school instead. My co-founders ended up doing different things. And fast forward a couple of years, as I was finishing grad school, we all knew each other and started hanging out. And we kind of bonded over this fact of interesting that we all almost went to med school. We went through the big chore of taking the MCAT, which is not something that most people would willingly do, and ended up not going through with it. And what we realized is that doctors didn't seem very happy at their jobs. Like for me personally, I was shadowing doctors, and so many of them just seemed unhappy. For Nate, he said that doctors actually would sit him down and say, "Don't go into this industry anymore." So we said, "Well, what's going on here? Why is this happening?" My grandfather was a physician, and he loved. I remember as a kid, just he loved talking about his job. He loved his job. He didn't complain about all the burdens on him and burnout. Those things weren't really complaints 30 years ago. So we started digging into why this has happened and started calling up hundreds of friends, connections in the industry. And what we ended up finding is that doctors do love being with patients, and that's why most of them went into the field. But we're at a place now where there's way too much data for them to go through and way too much administrative work for them to deal with, to the point where it's almost the majority of their day. Actually, it's not almost, it is the majority of their day is now spent doing non-patient care and focusing on this other work. And we said, well, this is crazy. I was in a program where I was getting in grad school where I got to be in touch with the latest and greatest of AI, now 8 years ago, and seeing how it was so obvious that in every other industry, they would say, give us more data and things get better. But for some reason in healthcare, the more data that has been present, arguably things have gotten worse in terms of workflows. So that's where we started realizing that there is a problem and seeing that there may be an opportunity here to build something to solve it.
And you know, talk me through a little bit about the AI component. So how did you build that technology? And it seems like the latest and greatest thing is every company trying to apply AI to their use case. Even in some cases, that's not the case with you. Yours makes total sense. Let's talk about though how you got to that point where that became clear that okay, we need to leverage AI. How did you build the technology?
Yeah, so it all comes down to not only did we realize that there's this problem, but we also saw it as an opportunity because one of the greatest changes that has happened in healthcare over the last, let's call it 2 decades, is the electronic medical record. While currently it's arguably made things worse for the workflow, I think in the long run it's going to make things better because it's created this mass digitization of clinical data. And we've gone from things being on paper charts to now tons of data in an electronic chart. The problem today is that doctors don't have the tools to actually see all that. 97% of data in a chart does not get seen by a doctor on an average visit, which is kind of crazy. They see the most important stuff, but so much is just unseen. So Nate and I get excited about this concept that we call inevitable futures. What does the world look like in 100 years? So, it's 2124. Imagine the world. It's hard to see a world where every car is not electric. It just kind of makes sense. And similarly, what just makes sense for the clinical space? It's hard for us to imagine a world where, for common conditions like a cold, like pneumonia, diabetes, the common conditions that most people deal with, that you're going to still have to go see a doctor to get care for that. We strongly believe that at some point in the near future, for common conditions, you will be able to get treated by AI, and it will arguably be better than any individual physician. I think that for procedures, surgeries, it's 100 long time until human doc. By no means I'm saying human doctors are going to get replaced, but for common conditions, I do think that you won't have to see a doctor. You can talk to Regard, hopefully, and it will be able to not only diagnose you very accurately, but create a treatment plan that is customized to your data profile. And so that's always been the vision, and that always meant AI from the very beginning of the company. It wasn't like let's slap AI into a business that we already had. It was from the very beginning, from day one, it was we are an AI company. And then the question was, well, to build anything in AI, you need access to data. So the product that we've developed is kind of the first step on this journey, the product not only helps doctors diagnose, but it also gives us access to clinical records that allows us to make our systems better. So that's kind of the story of how it started.
Yeah, going back to what you said earlier too, when you were talking about how clinicians don't actually get to spend much time with the patients anymore, which is really why a lot of them went into the field in the first place, right? Um, it's not because they loved going to school for all these many years and racking up a substantial amount of debt initially, right? But it kind of comes down to the what you said, the data overload, which you kind of alluded to earlier. We talked about the clinicians. Let's talk about the implications that this data overload and burnout has on the hospital health system itself.
Yeah, I mean, it's one of the craziest stats out there is if there's a paper that was published, I don't remember how long ago, but somewhat recently, where they tracked the ratio of clinicians to administrators over the last 20-25 years. And in the 90s, it was about two administrators for every clinician. And now I think it's about 17, 15, 17, maybe more administrators for every clinical facing person, including nurses, which is crazy. Like, so that's the result of what's happened is not only, and it's not like the health system's fault. We're in a state where you have 20 different insurance companies that you have to deal with. They all have their own different billing rules. You have to deal with denials from these insurance companies. You have to deal with writing letters. You have to deal with the patients. So this explosion of data that's kind of sitting there unstructured or unused is resulting in this administrative bloat, which also then impacts the physicians.
It's Your use case just makes so much. It kind of. I like how you used the electric car analogy earlier. Um, and I do want to go back to something else that you said earlier, right? When we were talking about the recent round of funding that you raised, right? So you just raised this Series B. It was led by Oak. Can you talk a little bit more about where you'll be investing in within the next 6 months throughout the company? And we've had Oak on, like, most of the portfolio companies have been on, which is great. So excited to have you on here. And then we recently had Nancy on from there to talk about some of the investments as well. Um, would love to hear kind of where you will be investing in over the next 6 months or so.
Yeah. So the main focus is like staying on core product still. We think that there's a huge opportunity there, and I've heard these stories from so many different founders of the downfalls, the pitfalls on if you get too excited and distracted by new products before, and then you kind of abandon what got you to where you are in the first place. So we're very mindful of that, and I think there's still so much opportunity. So we'll be investing in a lot of hiring for our engineering team to continue. We know exactly what we need to do to make our core product better. So that's going to be about, I call it 70% of our focus over the next 6 months, staffing up the team and building towards improvements on core product. Probably 20% is going to be focused on new product lines. So we have been getting pulled by our current customers to the clinics. And we've been wanting to go to clinics for many years. We just realized we didn't have the team size to do it. So that is the one like step that just, it's not a huge step to the side for us. It's kind of a very similar product. So that's something that we'll be planning to launch in the next 6 months. And we're even starting testing now. And then the last 10% is going to be building out a, like, I'd call it a data science part of the firm, a part of the company, not just like building algorithms, but actually, hey, we're sitting on a lot of really cool data. Let's bring in some really great data scientists to explore that and see, like I was saying, what if we could create a recommendation engine of, hey, this kind of patients come in, here's our recommended treatment plans to get them healthiest the fastest, because we're able to compare that data profile to millions of others that we have.
Why why do you feel that Regard is uniquely positioned to solve this clinical insights gap? And you mentioned this a little bit earlier, but if we can dig even deeper, like, what do you think's like the most unique about your approach to that?
There's two things that are very special about what we've done. The first thing is where we sit in the workflow. So if you track how a doctor does their workflow in both inpatient and outpatient settings, the first thing they'll do before they see a patient typically is they'll read the chart and kind of get an idea of what's going on with the patient. What's their history? Why are they coming in? Try to gather as much intel as they can. Then they'll go see the patient. Depending on the kind of patient, the conversation will add some more data. But if they're in a hospital, a lot of patients are very sick and aren't able to speak anyway, so that isn't too much of it. And then they'll kind of make their assessments of what to do in their plan. And we sit at that very first step. So a lot of doctors, the first thing that when we observe them, the first thing that they'll do when they open a new patient's chart is they'll open Regard. So we sit in that pole position to have an impact. And then the second thing that's very special about what we've done is everything that we have created is driven by the data that's already in the chart. So we sit on top of everything that doctor is already seeing and or has access to, and we can empower them with that data. And I don't think there's any other company out there that has the same access to data and uses it in that same part of the workflow. So it's very unique to us.
I want to go into a new segment with you, Eli, that we recently put together. It's basically a prompt of what's something you can laugh about now, but you probably wanted to cry about it at the time.
Yeah, easy. There's so many of those. Um, the first time we did a medical record integration, now we're like very good at it and we can do it consistently and very quickly. But the first integration we did took about a year, and it was very painful because we were learning. Even the medical record that we integrated with was learning at the same time. I remember the first call we had with them. we said, we need every single API you have. We need everything opened up. And they're like, that's crazy. No one's ever asked for that. I said, yeah, no, that's what we need. So they were kind of working with us to figure out how to do it the first time. And it was, yeah, very, very painful then, but now can laugh about it. Another one was trying to get our first proper hospital contract. We have the social proof, and now to kind of go to larger contracts right off the bat. But that first contract was really hard to get done. It was really hard to get out of the pilot phase, to put our foot down and say, hey, we're ready to grow to the next level here. That made me want to cry a few times, but now can kind of look back at it and laugh.
What's a piece of advice, kind of maybe on the pilot side, and being able to let's give advice to new founders on this next question. What's a piece of advice you would give to a new founder in the space for securing that pilot, but not just securing that pilot, actually converting that pilot to a customer?
Yeah, I'd say ultimately the most important thing is that your product is going to deliver value to someone, and to really believe in the value that you're delivering. And that, a lot of people will I remember a lot of people told me in the early days, like, never do pilots, never do that. And I don't think that's true. I think it's really hard in healthcare to, if you can avoid it and you get lucky, fantastic. But I think if you're building something new and innovative, it's really hard to avoid a pilot of some sort. And that's okay, because the most important thing for you to get is that first contract. And then it doesn't even have to be that you're getting a ton of money out of that contract. The most important thing is that it's a commercial agreement, and that the client likes you enough to go champion you and be a reference to provide that social proof to the next hospital, because it will make the second one easier, which will make the third one easier, and so on. So for us, but ultimately it has to deliver value to someone. So for us, we knew, talking to the doctors that were using our product, that they liked it, and they're using it every day on every patient. We saw it in our data. So for us, we said, hey, we know we're delivering value. We know your doctors like it. We're not going to ask for a ton for this first contract, but if we need something here to change, otherwise we're going to have to turn it off. And they said, okay, let's figure something out. We're your first customer. Give us a discount. And we made something happen.
And unfortunately, for people trying to land pilots, the organizations that have had bad experiences with pilots, it'll now be that much more difficult for them to land that pilot, right? So I was just on a panel it was almost a year ago, with one of the leaders from Tampa General Hospital, and they were saying in the past they would engage in pilots where maybe there was little initial value, then they would really try to experiment to see if there was something there. And that whole format has changed drastically over the last year or two, where there needs to be more results. You need to show more even before the pilot than maybe in years past. So it definitely, I feel like it did get more maybe difficult for founders, but that doesn't mean it's impossible, right?
Yeah, I guess one other tip I'd give for any, more early stage founder that's going into the space is, try your best to pilot with the group that you're going to end up working with. Because then I think what makes it really hard sometimes is if you come in through like an innovation arm or something, and the results may be even good, it can be hard to transition to a new budget, just because of the mechanics of how health systems work. So, if you do a pilot, really try to do it with the team or the group that would end up being the budget that you come out of in the future. That makes it a bit more likely to succeed.
Love it. Well, Eli, I want to thank you so much for joining us here on the podcast today, sharing some advice and also some stories. I know our audience is going to appreciate that. But wishing you the best of luck. Look forward to future conversations with you, and keep crushing it.
Yeah, thanks, Jared. It's nice to meet you too. And if you ever want to get my opinions on the future of health and AI, just give me a call.
Well, watch, you said that. Now I'm gonna be pinging you for correspondence. We'll definitely keep you in touch. We'll keep in touch for any of those updates.
All right, thank you.